Welcome back to the Vital Signpost. We're going on a deep dive today into the world of antianginal medications.
And really getting into how they work to help manage this condition that affects so many people, millions.
Now, I know you all listening. You've got a lot of experience under your belt.
Years of it.
So think of this as a focused refresher course.
Fine-tuning that expertise.
Right. With the latest insights on angina and the medications that can truly help your patients.
Because it goes beyond just knowing the names of these medications and what the dosages are. It's about really understanding how they're working on a physiological level, why they're chosen for specific situations.
And how to make sure our patients are safe when they take these medications.
Absolutely.
So let's just start by understanding our adversary here. Angina pectoris.
Right.
Angina. It's more than just chest pain, isn't it?
No, it is. It's a very specific type of chest pain caused by a very specific thing, an imbalance in the heart. The heart muscle isn't getting enough oxygen-rich blood to meet its needs.
So, think of your heart as this incredible, powerful engine working all the time to keep your body going. And just like any engine, it needs a constant supply of fuel. And that fuel is oxygen.
Right. Delivered by the blood.
And when the coronary arteries, those pathways carrying that vital blood,
when they become narrowed, or blocked even, that's when the heart sends out a distress signal, angina.
And that blockage that you're talking about, a lot of times that's atherosclerosis.
Right.
Yeah.
Atherosclerosis is the buildup of plaque, cholesterol, and other substances in the artery walls. And it can gradually narrow those pathways.
Restricting blood flow.
Exactly, like rust accumulating inside of pipes.
But yeah.
You know, it's slowly but surely impeding the flow.
So when we talk about coronary artery disease, or CAD,
right,
it's kind of like the umbrella term.
the big picture.
And atherosclerosis is the culprit underneath that leads to that restricted blood flow that causes angina.
Right. And it's not just discomfort. This is a warning sign. Because if it's left unchecked, it can actually lead to a myocardial infarction.
A heart attack,
Yeah.
where a portion of the heart muscle
Doesn't get enough oxygen.
is deprived of oxygen.
It just starts to die.
So this is serious stuff and why it's so important for us to understand
It is.
angina and how to manage it.
And add to that angina doesn't always present the same way.
Right. It's not one size fits all.
No, it's not. It presents in different forms, each with its own characteristics and implications for treatment.
So we have stable angina, unstable angina, and then there's that less common vasospastic angina.
Right.
Can you walk us through those a little bit?
Sure. We can start with chronic stable angina. This is the most common type.
Okay.
And it's usually triggered by exertion or stress.
Okay.
You know, like climbing a set of stairs.
Yep.
Or you're dealing with a stressful situation. The key is that it usually follows a predictable pattern, subsiding with rest or medication, you know, as the heart's oxygen demand decreases.
So it's almost like a temporary fuel shortage.
Right.
And once the demand eases, then the supply can catch up.
That's a good way to think about it.
Yeah.
No, unstable angina. This is also sometimes called pre-infarction angina.
Oh, wow.
Yeah. And it's a completely different thing. And this is where the vigilance comes in. It's a warning sign that coronary artery disease is progressing.
Okay.
And the risk for a heart attack is higher.
So this is where it's really important to recognize those subtle differences.
Absolutely. It's subtle, but it's crucial because it doesn't follow the same predictable pattern. The pain may be more intense, occur more frequently,
Wow.
or even happen at rest.
So that's really serious.
It is. It's a warning sign that something is changing, that the balance between oxygen supply and demand is becoming really precarious.
And then we have that vasospastic angina,
Right.
which seems like it's got a whole different personality.
It does. It's different. Because instead of being triggered by increased demand, it's actually caused by spasms in the coronary arteries.
Oh, wow.
Yeah, so it's a temporary constriction of the blood flow.
Wow.
And these spasms can be unpredictable.
Really?
Yeah, they can often happen at rest. And the pain can be very intense.
So we've got these different types of angina, each with their own little quirks,
Yeah.
but all rooted in the heart not getting enough oxygen.
Right.
So that's where antianginal medications come in.
Right. And just like angina has different types, we have different classes of medication, each with its own mechanism of action, its own way of addressing the problem.
It's finding the right tool for the job.
Exactly.
Understanding which medication will be most effective in each specific situation.
Got it.
So can you walk us through those different tools, those classes of antianginal medications?
Of course. We can start with the nitrates, the heavy hitters in the acute setting.
Okay.
So think about nitroglycerin.
Oh, yeah. The class.
The classic.
Yeah.
It works by relaxing and widening blood vessels, primarily the veins. And what this does is it reduces the amount of blood returning to the heart.
Okay.
So the workload on the heart is decreased.
So it's easing pressure on a system that's already struggling, giving it a break.
Right. And the nitrates come in different forms, too,
Right.
each with a different speed and duration of action.
That's right. So we have sublingual nitroglycerin,
Right.
which is absorbed very quickly
Very quickly.
through the lining of the mouth.
It goes right into the bloodstream, and it provides relief within minutes.
The emergency response team,
Exactly.
ready to act right away.
For acute attacks.
Yeah. And then for long-term prevention, we have things like transdermal patches,
Right.
which release the nitroglycerin slowly.
Through the skin.
Yeah. So it keeps that consistent level over a long period of time.
Exactly. It prevents the angina episodes from happening in the first place.
And then you mentioned those other nitrates.
Right.
The isosorbide dinitrate and isosorbide mononitrate. Where do those fit in?
So those are often prescribed for long-term management of angina.
Okay.
They come in different forms.
Okay.
Allowing for tailoring to the individual patient's needs.
So it's like having a diverse toolbox.
Yeah.
Each tool suited to a specific task.
Absolutely.
Now let's move on to beta blockers.
Okay.
These medications work in a totally different way.
Totally different.
They block the effects of adrenaline.
Right. Which is that hormone that triggers that fight or flight response.
So instead of working on the blood vessels themselves like nitrates do,
Right.
beta blockers
Right.
work by calming the heart down.
Exactly.
So they're reducing its workload.
Right. They block the adrenaline and they slow down the heart rate and decrease the force of those contractions,
Okay.
which lowers the heart's demand for oxygen.
So it's like taking your foot off the gas a little bit,
It is.
allowing the heart to work at a more sustainable pace.
Exactly.
Now, beta blockers, they have some other cardiovascular benefits too, don't they?
They do.
So they can manage high blood pressure.
Mm-hmm.
And they're also given after a heart attack.
They are
Yep.
to reduce the risk of future cardiac events.
And some of them are selective,
Right.
targeting very specific receptors in the heart,
Yes.
while others block a broader range of receptors.
Yeah.
So that's important, especially for our patients who have respiratory conditions
Very important.
like asthma,
Mm.
where a non-selective beta blocker could worsen their breathing problems.
Exactly. You have to choose the right tool for the job. Thinking about the individual patient and their needs.
And then finally, we have calcium channel blockers,
Yes. CCBs.
CCBs.
They're kind of the smooth operators
Right.
working directly on those blood vessels to improve blood flow. So they relax the muscles
Okay.
in the artery walls, which allows them to widen.
So,
And that increases blood flow to the heart muscle.
so it's like easing the tension in a clenched fist.
Right. Allowing the blood to flow more freely.
And like the other classes, there's a variety within the CCB family too.
Oh, absolutely.
Right.
Yeah, there's diversity.
So some are affecting mainly the blood vessels.
Right.
And others influence heart rate and contractility as well. And that diversity allows for us to individualize the treatment even more.
Absolutely.
Right.
Matching the medication to the patient's needs.
So we've got our three main classes of antianginal medications, nitrates, beta blockers,
Right.
and calcium channel blockers.
Each with its own unique mechanism of action, its own set of benefits and risks.
And understanding those nuances is so crucial for making those decisions
Yes.
about which medication to use,
Right. When to use it.
when to use it,
Yeah.
and for whom.
Exactly.
Now, we've laid the groundwork,
Yeah.
exploring the different types of angina,
Right.
the different classes of medications.
Yeah.
But before we dive in to those specific medications and their own unique characteristics, it's important to understand
Absolutely.
that these medications, they're not magic bullets.
They're not.
They have potential side effects,
Yeah.
interactions, and contraindications
Right.
that we as nurses need to be aware of.
You're absolutely right. It's not just about knowing what to give. It's knowing when to hold back. When a certain medication might do more harm than good.
So it's that balance between benefit and risk.
It is.
And we'll continue to explore that balance as we dive deeper into the world of antianginal medications.
Right.
Stay with us.
We'll be right back. Now, we've talked about these different classes of anti-anginal medications, but as you know, each class has a whole variety of specific medications within it, each with its own unique characteristics.
That's right. It's like having a well-stocked toolbox.
Right.
You wouldn't use a hammer for every repair job.
Right. Absolutely.
So let's delve into some of those specific medications and really understand, when and why we choose one over the other.
Okay. A good place to start would be with the nitrates. We've already talked about nitroglycerin and its role in those acute angina attacks.
Right.
But let's talk about, the different forms it comes in and when we might choose one over the other. So in those acute situations, sublingual nitroglycerin is still the gold standard.
That's right.
It's rapid absorption, it's quick onset of action.
Yeah.
Make it ideal for providing that immediate relief.
Exactly. That's the medication we reach for. When a patient is experiencing chest pain and they need relief fast.
Absolutely.
But what about long-term prevention?
For that, we have options like transdermal nitroglycerin patches.
Okay.
And those provide that slow, steady release of the medication through the skin.
Okay.
Ensuring that consistent level in the bloodstream over that long period of time.
So, sublingual for that immediate crisis.
Right.
And patches for that ongoing management.
Exactly.
Now, you mentioned those other nitrates too.
Right.
The isosorbide dinitrate
Yep.
and isosorbide mononitrate. Where do those fit in?
So isosorbide dinitrate and isosorbide mononitrate are often prescribed for that long-term management of angina.
Okay.
And they come in both immediate release and sustained release oral forms.
Oh.
Okay. So it gives us some flexibility in how we tailor that treatment to an individual patient's needs.
So it's all about finding that right fit for each patient's situation.
It is.
And of course, we need to be mindful of potential side effects.
Yes, we do.
Like headache, dizziness, lightheadedness, which are all pretty common with nitrates.
Right. And that's why it's important to start with a low dose, gradually increase it as needed.
Yeah.
Carefully monitor for any of those adverse effects.
Especially in our older patients.
Absolutely.
We might be more susceptible to those side effects. Now, speaking of older patients, are there any specific considerations that we need to keep in mind when prescribing nitrates for that population?
Yes, definitely. Older adults, they're much more likely to experience those age-related changes in their cardiovascular system.
Right, like decreased blood vessel elasticity.
Right.
And maybe reduced kidney function.
Which can all affect how their bodies actually process and respond to these medications.
So we really have to be cautious with dosing.
Absolutely.
And monitor them closely for any signs of hypotension or other adverse effects.
Or other problems.
Right. Yeah. It's about recognizing that. What works for a younger patient might not be appropriate for an older adult.
Absolutely. You're right. We have to adjust our approach based on those individual needs and vulnerabilities.
Absolutely.
Okay, now let's shift gears a little bit and talk about beta blockers.
Right.
As we mentioned earlier, these medications work by blocking the effects of adrenaline, which reduces the heart rate and that contractility, which lowers the heart's demand for oxygen.
Right.
And one of the commonly prescribed beta blockers is metoprolol.
Metoprolol, yes. That's a very familiar name in our practice.
Very common.
I know it comes in different forms.
It does.
What's the difference? Does it matter which one we choose?
It does matter. So metoprolol comes in both immediate release and extended release forms.
Okay.
So metoprolol tartrate is the immediate release form, and that's typically used for managing acute situations, like an angina attack.
Okay.
And then you've got metoprolol succinate, which is the extended release form.
Okay.
That's often prescribed for long-term management.
Of angina.
Of angina and other cardiovascular conditions.
So it's similar to those nitrates.
It is.
With the different forms for different purposes.
Different purposes.
And I imagine the dosing and frequency would vary depending on which form we choose.
Absolutely, it does. That's why paying attention to that specific form when you're prescribing it, you're administering it, is absolutely crucial.
Right.
We don't want to confuse the two and inadvertently underdose or overdose a patient.
Right. And we really need to be mindful of potential interactions with other medications as well.
Absolutely. Especially in our older patients who are often taking multiple drugs. Polypharmacy is a big issue.
Yeah, it is.
And beta blockers can interact with a variety of other medications, including those used to treat diabetes, high blood pressure, And even some over-the-counter medications.
Right, like NSAIDs.
I mean, NSAIDs, exactly.
So that medication reconciliation is so essential.
It is.
And speaking of interactions, beta blockers can mask the symptoms of low blood sugar.
Yes, they can.
Right.
They can.
Which could be concerning.
Absolutely.
Especially for our patients with diabetes.
It's a very crucial point because beta blockers can actually blunt those natural warning signs that the body gives us.
Right, like the sweating, the tremor,
the palpitation,
yeah,
which can make it really hard for patients with diabetes to recognize when their blood sugar is dropping.
Right, dangerously low.
Dangerously low.
So we have to be monitoring that blood glucose very closely.
Absolutely.
For those patients.
Closely.
Yeah, it's a good reminder that we can't just focus on one condition in isolation.
Now look at the whole patient.
We need to consider the whole patient, their medical history, their medications.
Their vulnerabilities.
Their vulnerabilities, exactly.
Let's talk about another commonly prescribed beta blocker.
Okay.
Atenolol.
Atenolol.
Now, atenolol is known for its long duration of action, which makes it really convenient for once-a-day dosing.
Yeah. Atenolol, I've prescribed this a lot for patients who just have difficulty remembering to take multiple medications.
It's a good option for those patients. But we do have to be mindful of potential side effects.
Of course.
Like fatigue, dizziness, and even depression, which can be more pronounced in, you guessed it, older adults.
Right.
So,
again, weighing the benefits against the risks.
Absolutely.
And really individualizing that treatment.
Individualizing treatment, yes.
Based on that patient's needs and their circumstances.
All right, now let's talk about our final class of antianginal medications.
Okay.
Calcium channel blockers.
CCBs.
CCBs. And these work by relaxing the muscles in the artery walls, allowing them to widen, increasing that blood flow to the heart muscle.
Okay.
And one of the most commonly prescribed CCBs is amlodipine.
Amlodipine, yes. That is a popular choice.
It is.
And I found it to be generally well tolerated.
It is generally well tolerated.
Yeah.
And it has a long duration of action, making it convenient for once daily dosing. But it can cause side effects like headache, dizziness, flushing, and peripheral edema.
Right. Swelling in the legs and feet.
Exactly.
Yeah, that's right. Peripheral edema is something I've seen in some patients taking amlodipine.
Yeah, it can happen.
So we need to educate our patients about this potential side effect.
We do. Absolutely.
And monitor them closely.
Monitor them closely. And then another commonly used CCB is diltiazem.
Diltiazem.
And diltiazem comes in various formulations, including immediate release, sustained release, and extended release.
Diltiazem, yes.
Yeah.
I remember learning about all those different formulations.
There's a lot.
Yeah. It's a lot to keep straight, but it's important to differentiate between them.
Absolutely. Because the dosing and frequency will vary. So we need to be precise with our prescribing and administration to make sure the patient is safe.
And then we have verapamil.
Verapamil, which is often used for treating angina, high blood pressure, and some heart rhythm disorders.
Okay.
But it has a stronger effect on the heart than some of those other CCBs. So you have to use it cautiously in patients with certain heart conditions.
Verapamil.
Yeah.
That's not one I prescribe as often as amlodipine or diltiazem.
That's not as common.
But it's good to have that range of options.
Absolutely. It's good to have options.
And it's important to remember that each medication within a class has its own unique properties.
Absolutely.
Right.
It does.
And potential effects on the cardiovascular system. So we need to consider all those factors.
We do.
When making those treatment decisions.
Absolutely.
Wow. This deep dive into these specific antianginal medications has been really informative. We've explored the mechanisms of action, the different forms they come in, the benefits,
the risks,
the potential drawbacks.
Yeah.
And it's clear that there's no one-size-fits-all approach to angina management.
No, there isn't.
Yeah.
Each patient is different. And you need to tailor your treatment plan based on their individual needs, their medical history, their other medications, and their lifestyle.
Now that we have a solid understanding of these medications themselves, let's shift our focus a little bit to the nursing considerations for patients on antianginal therapy.
Sounds good.
After all, we, as nurses, play such a crucial role in ensuring that these medications are being used safely and effectively.
We do.
Right.
It's an important role.
And in a way that truly benefits our patients.
It's all about the patients.
We've really covered a lot of ground, haven't we?
We have.
Exploring the different types of angina.
Right?
And then delving into those specifics of all the different antianginal medications.
Absolutely.
But now, I want to shift our focus to the heart of nursing care. Putting all of this knowledge into practice at the bedside.
Yeah. Okay.
So I'm eager to hear your insights on how we can best care for these patients who are taking these medications.
Well, it really comes down to bridging that gap between theory and practice, right? Using all this knowledge that we've been talking about to provide truly patient-centered care. And I think it starts with that. Thorough assessment.
Right.
Gathering all the pieces of the puzzle so we can come up with a comprehensive and individualized care plan.
And that assessment goes beyond just checking vital signs, doesn't it?
It does.
It's about really understanding the whole patient.
Right.
Their medical history, their lifestyle. What are their concerns? What are their goals?
It's like detective work, isn't it?
It is.
Piecing together all these different clues so you can really understand what their individual situation is. So we need to carefully review their medical history. Are there any other conditions like diabetes, high blood pressure?
And of course, that complete medication list is so important.
Absolutely, because we have to identify any potential interactions, contraindications, before we even think about adding another medication.
And don't forget about those over-the-counter medications.
Yeah.
And supplements.
That's right, because those can interact too.
They can.
Yeah.
You need that full picture.
It's about being really thorough and asking the right questions.
It is.
And then there's that physical assessment, monitoring those vital signs, really looking for those red flags.
That might tell us that something's not quite right.
Especially blood pressure and heart rate.
Right.
We need to be very vigilant about monitoring for hypotension, especially in our older adults.
Right. They're more susceptible to those blood pressure fluctuations.
They are.
And of course, we can't forget about assessing the angina itself.
Right.
So what is their chest pain like? How does it start? How long does it last?
The intensity.
The intensity. What brings it on?
Exactly. We need to understand their experience with angina so we can tailor the interventions effectively.
So we've gathered all this information through our assessment. Now what? How do we take that information and translate it into a plan of care?
Well, this is where our nursing expertise really comes in. We take everything we've learned about this patient. What type of angina do they have? What are their individual risk factors, their medication history?
Yeah.
And then we develop a care plan that's specific to their needs.
And it's not about just following some protocol.
No, it's not.
Right. It's about individualizing care.
It is recognizing that each patient is different.
Absolutely. And a huge part of that is patient education.
Absolutely. We need to empower our patients to understand their condition, to understand their medications, and all the lifestyle changes that can help them manage their angina better.
Patient education is so important because we're kind of shifting that power dynamic, from a very paternalistic approach to one that's more collaborative, where the patient is really
an active participant.
An active participant in their care. Exactly.
Yeah, and we want our patients to feel confident and informed, not overwhelmed and confused. We want them to understand the why behind the what, why they're taking this medication, the rationale for the treatment, the importance of sticking to that medication regimen.
Absolutely.
Yeah.
So how do we do that effectively? What are some of your go-to strategies for educating patients?
Well, first and foremost, I think we have to meet patients where they are. Think about their learning styles. What's their health literacy level? Their cultural background.
It's not a one-size-fits-all.
It's not a one-size-fits-all, just like their medication regimen.
So we're tailoring that education.
Each patient, exactly. For some patients, simple verbal explanations might be enough. For other patients, they might need something visual, like a pamphlet, or even a video.
Right.
So you have to be flexible and adapt.
And it's not just about giving information. It's about engaging them in a dialogue.
It is.
Right.
Encouraging them to ask questions, to share their concerns.
So we're creating that safe space, that supportive environment.
Absolutely.
Where they feel comfortable speaking up.
Right. And it's ongoing. We need to reinforce that education, make sure they understand what we're talking about, address any new questions, concerns.
Yeah. Patient education isn't a one-time thing. It's an integral part of that ongoing care.
It is.
Absolutely. So beyond that medication education piece,
Mm.
what are some of the other key nursing interventions
Yeah.
for these patients with angina?
Well, one crucial intervention is promoting comfort. You know, angina is characterized by that chest pain,
Right.
which can be really scary and distressing.
Mm-hmm.
So we need to provide both physical and emotional support.
Right.
And that might involve simple things like positioning them comfortably, maybe offering a warm blanket, making sure the environment is quiet and dimly lit.
Right. Attending to those small details.
But small details make a big difference.
They do. They do. And managing anxiety.
Yes, because we know that
Yeah.
stress and anxiety can actually trigger those angina attacks or make them worse.
Mm-hmm.
So helping our patients find some healthy coping mechanisms is really important.
Absolutely. Whether it's relaxation techniques, deep breathing exercises,
Yeah.
guided imagery.
Right. Anything to help calm that mind and body.
Right. And of course, we always have to emphasize lifestyle modifications as well.
Yes. Lifestyle plays a huge role in managing angina.
Mm-hmm.
So we need to educate our patients about the benefits of regular exercise, a heart-healthy diet, stress management, and of course, smoking cessation.
It's about giving them the power to take control of their health, make choices that support their heart health.
Exactly. And setting realistic goals too, recognizing that small changes can make a big difference over time.
They can. Wow, we've covered so much in this deep dive, exploring all those complexities of angina and the nuances of antianginal therapy. It's been a really valuable refresher for me, reinforcing that knowledge, and I think giving us some practical strategies to improve our nursing care.
I agree. It's a good reminder that nursing is constantly changing.
It is.
And we always have to stay informed and engaged to provide the best care for our patients.
And it's a testament to the power of lifelong learning.
It is.
You know, no matter how many years of experience we have under our belts, there's always more to learn.
Absolutely.
And more to share with our colleagues.
Well said. I've really enjoyed our discussion today.
Me too.
It's been a pleasure sharing these insights with such a dedicated group of nurses.
Well, thank you for joining us today on the Vital Signpost. We hope you found this deep dive into antianginal medications to be informative and empowering. And remember, knowledge is power.
It is.
And sharing that power with our patients empowers them to live healthier and happier lives.
Absolutely.
So until next time, stay curious, stay informed, and stay well.
We'll see you then.